Hey everybody, Dr. Leigh Miller here, your TMJ physical therapy specialist. Today, we're going to talk about the fourth muscle involved in mastication or chewing, and that's going to be your medial pterygoid. Now, he's pretty cool. I don't know if he's as cool as the lateral pterygoid, but honestly, they're just so different. They're both pretty cool, and they both can cause havoc and create a decent amount of pain for somebody with jaw pain. So it's really important that we understand it so that we can release it so you can go on about your life. So what is or where is this medial pterygoid? The medial pterygoid originates on the lateral pterygoid plate of the sphenoid bone inside the skull. It's going to insert onto the medial aspect of the ramus of the mandible. Okay, so think inside, right? You can actually palpate this medial pterygoid if you go along the angle of the mandible right here, just a little bit in front of it. You can hook your thumb or hook your finger, right, just underneath that mandible, and you're going to feel some tenderness. It's not going to feel comfortable, right? Right in here. That's your medial pterygoid. So now that we know where that is, let's talk about what it does. It actually is involved in mandibular elevation, mandibular protrusion, and contralateral or left and right motions. So when would I know, or how would I know, Dr. Miller, if my medial pterygoid is even involved? I really don't understand. Great question. So you're going to feel this cloggy sensation in your ear, maybe some ear pain. You may experience some headaches, even, some fullness in that ear. That can be a sign that the medial pterygoid is very much involved, in addition to other muscles. Also, a limit in your ability to open all the way. While that could mean other things going on, your medial pterygoid is likely involved. So, before you go on the medication train, before you go down a conversation of imaging or anything like that, let's see if a simple release can help. All right, so here's your technique. Before we go into our technique, I want you to make sure that you glove up or thoroughly wash your hands. Sing that birthday song twice, as I always say, and make sure you lather up, soap up, and wipe down, because we are still in COVID and we do not want to pass germs to ourselves from other people, right? So I have washed my hands, and I'm going to use just my hands today. What you want to do is, there's two ways that you can do this. You can actually take your finger and follow your back teeth all the way until you hit sort of a bony prominence. Right? Now go on the inside of that bony prominence, just beyond that back molar. Okay? Back there, what I want you to do is press into that roadblock, that bony prominence area. It should feel sort of squishy. Think about feeling for a ripe tomato. Sorry if I just ruined tomatoes for you. All right. Once you're back there, you can go sort of a small back and forth movement if you'd like, or you can just hold it. But what I'm going to ask for is firm, medium to firm pressure. Do not bruise yourself. Do not cause tears to go streaming down your face, right? That's not going to do you any good. What I want you to do, though, is to apply a pressure so that it sort of hurts so good, right? You're going to hold that or move that finger for 10 to 15 seconds, and you're going to perform this 3 to 5 times. So I will demonstrate. Hold. Close slightly, but don't chomp down on your finger. Okay? Now, I could do it longer, but I don't want you to stare at me while I rub the inside of my mouth. Right? All right, the second one that I want you to do is going to be, or an option that you can do, you're going to find your medial pterygoid this way by going on the inside of your teeth and down. So you're going to follow your teeth on the inside and sort of fall down into this soft tissue area. You're going to feel it. It's not going to be super comfortable at all, but that's going to be your medial pterygoid, and that's where I want you to hold it or to give a little back and forth motion, right, for 10 to 15 seconds, 3 to 5 times. I will demonstrate. Again, I did not hold that for the appropriate amount of time, but it gives you the idea. You want to do this every other day until symptoms reduce. You should feel a release pretty quickly, and you should feel a smoothness in your opening and closing. If you are tight enough, if things are tender just enough, this could actually cause a little bit of discomfort and a little bit of soreness afterwards. Don't let that scare you, right? We want to back off. We don't want to do this every single day if that's what's happening, but it could be, and it could be your body speaking to you, saying that you need to actually contact a TMJ specialist like myself or someone in your area that can help you to release it in a different way. It may need intramuscular dry needling or another form of release. So again, try this at home yourself, and if this doesn't help, then contact your local TMJ specialist. In the meantime, happy releasing! Until next time.